You wake up, your feet touch the floor, you stand up, and there's this stabbing pain in your heel. Sharp, shocking, like you've stepped on something that isn't there. If you've experienced this, you already know how confusing it is. The pain fades as you move around. By mid-morning, you've almost forgotten about it. Then you stand up after sitting for a while and it's back. I'm Dr. Lucas Marchand, the house call chiropractor here in Sioux Falls, and today we're going to break down exactly what causes that morning heel pain, how it gets diagnosed, and most importantly, what actually works to fix it. Here's what makes heel pain so distinctive. It's worse with your first steps in the morning. As you walk and the tissue warms up, it improves. But after a full day on your feet, it comes back with a vengeance. This pattern tells us something important. We're dealing with inflammation and mechanical stress, not structural damage. And here's the challenge. Heel pain isn't just one condition. It's several different problems that can all present with similar symptoms. So let's break them down. The most common cause by far is plantar fasciitis. The plantar fascia is a thick band of tissue running along the bottom of your foot from your heel to your toes. Think of it like a bowstring that supports your arch and absorbs shock with every step. When this tissue gets overloaded, it develops microscopic tears and inflammation. That's plantar fasciitis. Some of the classic symptoms include sharp, stabbing pain at the inside edge of your heel, worse with the first steps in the morning or after sitting. It usually improves with movement as the tissue warms up. Returns after prolonged standing or activity. Who gets this? Here in Sioux Falls, I see clear patterns. It's teachers standing on hard classroom floors, factory workers, healthcare workers making rounds all day, runners training for a big event. The common thread is repetitive mechanical stress. Too much load, not enough recovery time. Risk factors include worn out shoes with no arch support, tight calf muscles, weight gain, sudden increase in activity, jobs requiring prolonged standing, age. The fascia loses elasticity over time. Now we need to address the biggest misconception about heel pain, heel spurs. You've probably heard someone say, "I have a heel spur, that's what's causing my pain." Or maybe you've seen a spur on your own x-ray. But here's the truth. Heel spurs do not cause pain. Let me give you the data. About 10% of the population has heel spurs visible on an x-ray. Most of them have zero heel pain. And many people with severe plantar fasciitis have no spur at all. So what is a heel spur? It's a bony growth that forms where the plantar fascia attaches to the heel bone. It develops over months or years in response to chronic tension. Your body is trying to reinforce a stressed area. The spur is a marker of chronic stress. It's not the cause of your pain. The pain comes from inflammation and micro tears of the soft tissue, the fascia itself, not from the bone. This matters because it changes treatment. You don't need a surgery to remove the spur. You need to address the mechanical overload causing the fascia inflammation. Surgery for heel spurs is needed in fewer than 5% of plantar fasciitis cases. Fasciitis is the most common cause, but not the only one. Heel contusions. Here in Sioux Falls, where we deal with ice from November through March, heel bruising from slips and falls is common. The pain is more diffuse, worse with direct pressure, and usually has a clear injury event you can point to. Fat pad atrophy. This is more common in older adults. The natural fat cushioning under your heel bone thins with age. It feels like you're walking directly on your bone. The pain is a deep ache that worsens throughout the day. I see this especially in people who work on concrete floors. Then there's tarsal tunnel syndrome. This is a nerve compression, basically carpal tunnel syndrome, but in your foot. The posterior tibial nerve gets compressed behind the inner ankle. Symptoms include burning, tingling, or numbness that radiate into the heel and arch. It feels different than plantar fasciitis. Achilles tendinopathy. This affects the back of the heel where the Achilles tendon attaches. The pain is sharp when you push off or when you're climbing the stairs. Common in people who increase training intensity too quickly. It's fractures of the heel bone, rheumatoid arthritis, infections, tumors. Red flags should get evaluated immediately if you have pain that worsens at night, fever or unexplained weight loss, pain that doesn't improve at all with rest, severe pain from a specific injury. We figure out what's actually causing the heel pain. The physical examination is more important than imaging, in my opinion. What we look for first is we just observe. How are you distributing your weight when you stand? Are you shifting away from the painful heel? Then there's palpation. Where exactly does it hurt? Plantar fasciitis has very specific tenderness at the inside of the edge of the heel where the fascia attaches to the bone. There's range of motion testing. Tight calf muscles, that increases tension on the plantar fascia. Functional tests. Can you rise up onto your toes? How does your gait look when you walk? There's imaging. X-rays can rule out fractures and show heel spurs, though remember, spurs don't cause the pain directly. MRI is rarely needed, but can show soft tissue inflammation, tears, or other pathology, and if the diagnosis is unclear. Is that diagnosis is clinical. The examination finding tells the story. Imaging confirms it. Here's what actually works for plantar fasciitis. And I'm going to be honest, it requires patience. There's no quick fix. This takes weeks to months. What you need is mechanical unloading and tissue remodeling. Home treatments that actually work, stretching protocols, this is critical. So, calf stretches 3 times a day, plantar fascia stretches with a towel before you get out of bed in the morning. Morning stretch pre-tensions the tissue before you step. Night splints, a boot that holds your foot in a flexed position while you sleep, prevents the fascia from tightening overnight. Makes a dramatic difference for morning pain. Footwear modifications. Get properly fitted shoes with good arch support. If you're serious, go to a running store for gait analysis. Add over-the-counter orthotic inserts for daily shoes. Replace worn-out shoes. They're not doing you any favors. Then there's ice therapy. Roll your foot over a frozen bottle of water for 10 minutes each evening. This is going to reduce inflammation and provide immediate relief. Activity modification. If running aggravates it, switch to swimming or cycling temporarily. Avoid prolonged standing when possible. Don't push through severe pain. And there's a time to see other providers. I'm a chiropractor, so some treatments are outside of my scope. But you should know what options exist. Physical therapy is one of the most effective interventions. Strengthening weak foot muscles, improving ankle mobility, and gradually loading the tissue to promote healing. For more advanced cases, medical doctors may recommend custom orthotics from a podiatrist. Corticosteroid injections for severe pain. Use sparingly. Platelet-rich plasma, PRP. Shockwave therapy. Surgery as an absolute last resort. Like I said, needed in 5% of cases. If you're considering any of these medical interventions, consult your primary care doctor or podiatrist. They can evaluate whether your options are appropriate for your specific case. We summarize the most important points. 1. That morning heel pain is most likely plantar fasciitis, inflammation of the tissue of the bottom of your foot. 2. Heel spurs don't cause the pain, they're just markers of chronic stress. 3. Diagnosis is clinical. The physical exam matters more than the x-ray. 4. Treatment requires patience, stretching, proper footwear, and ice therapy are your foundation. Most cases improve with conservative treatment over weeks to months. 5. If you have red flag symptoms like night pain, fever, pain that doesn't improve with rest, get evaluated immediately. Heel pain is common, but it doesn't have to be permanent. Your body has remarkable capacity to heal when given the right support and enough time. The key is accurate diagnosis, evidence-based treatment, and patience. If you're dealing with heel pain here in Sioux Falls, drop a comment below or reach out to me at MyChiro, housecall.com. I'm here to help. If this video helped you understand what's going on, hit that like button and subscribe for more evidence-based healthcare content.